Along with the infection, here are some of the signs and symptoms experienced by Clara. One is frequent urination within the day. Second is difficulty or burning sensation when urinating. Third is passing only small amounts of urine. Another one is that her urine appears to be cloudy and strong smelling. And she experienced low stomach pain. Other symptoms may also include bright red urine, which may indicate that blood is present in the urine, having poor bladder control, low-grade fever, flank pain, and even malaise. Wondering about how to assess UTI? Well, there are two laboratory and diagnostic procedures. These are urinalysis and urine culture. Let's discuss the difference. Urinalysis is the most frequently used to evaluate potential UTI. The patient's urine is tested with a special strip to check for infections such as blood and white blood cells. This checks the contents of urine, such as appearance and concentration. This can also help in evaluating the kidney function since kidneys plays a major role in excreting waste materials. In simpler words, this procedure checks and assesses the urine. Urine culture, on the other hand, is a diagnostic test where the urine is analyzed and examined for the bacteria present in the urine. This will help the doctor diagnose UTI and prescribe antibiotics for the treatment course. Urine culture is collected using a clean catch technique. It can be through suprapubic aspiration for infants or catheterization for children and adults. This is to avoid contamination of the sample urine and to avoid false results. These tests are not the only ones done. The doctor may also recommend additional diagnostic tests to further examine the cause of UTI. Some are kidney and bladder ultrasound, voiding cystourethrogram, nuclear medicine renal scan, and CT scan or MRI of the kidney and bladder. Although infected, baby Clara should never worry because UTI is completely treatable. Here are some of the medications that the doctor may prescribe. A broad-spectrum antibiotic may be prescribed, such as sulfamethoxazole trimetropin, amoxicillin, and nitrofurantoin. Broad-spectrum are very effective since it targets both types of bacteria, the gram-positive and the gram-negative. As part of the medical management, if pain persists during urination, acetaminophen or paracetamol may be orally taken by the client to reduce the pain. One good practice is drinking large quantities of fluids, such as water, to flush out the infection out of the urinary tract. Another fluid that the client may drink is cranberry juice, as it acidifies the urine and makes it more resistant to bacterial growth.